Welcome back. Is a new coronavirus expected next year? Many epidemiologists are now opining that there are all the makes of a new coronavirus which may emerge shortly after this one is done with. Now, coronaviruses are thought to have been circulating in bats for centuries, but have only recently become a leading source of zoonotic diseases alongside other illnesses that originated in animals such as HIV, Ebola, and Zika. Now, scientists blame the rise in the spillover of pathogens from animals on two trends: rapid globalization and humanity's cavalier interaction with nature. This means disease outbreaks and pandemics are likely to emerge regularly unless the trends can be checked or reversed. So, are we talking of doing away with globalization or deglobalization, as I would like to call it? The coronavirus pandemic is completely unsurprising. We knew before this happened that 2/3, if not 3/4 of emerging infections were occurring because of the spillover of pathogens from wild animals into people. Now, this is something which is according to Aaron Bernstein, director of the Center for Climate, Health and Global Environment at Harvard University. The Dr. Bernstein said that a primary reason for the crossover was a change in how people engage with nature, such as rapid deforestation and the global wildlife trade. We swim in a common germ pool with other animals. That's what he has said. And that's what seems to be the underlying cause of coronavirus as it is appeared in 2020. Although we call it COVID-19, presumably it has originated in 19 and that's why we call it so. Jonathan Epstein, Vice President at EcoHealth Alliance, a US-based wildlife charity, said that land use change, including deforestation, was the single biggest driver for emerging diseases. Construction of logging roads to extract timber created access to deeply forested areas previously largely uninhabited by human beings, bringing them into contact with disease-carrying wildlife. So displacement of animals that lived there also forced them to find new habitats. So they come and stay with us instead of the deep forest where they were staying before. This increases the chance of them spreading pathogens to other species, including humans. Now, Joe Watson, Senior Vice President at the US-based Wildlife Conservation Society, also pointed to the trade in wildlife for products such as exotic food, fur, and alternative medicines. And we have had zoonotic diseases in the past, but they have been rare with large periods of time between the outbreaks. But now the regularity is increasing. So, which means to say, one coronavirus is gone and another one is ready to appear. Is that so? Now, the regularity is increasing and it will continue to increase until we decide to reassess our relationship with trading animals and with nature. Initially, Chinese health officials thought that COVID-19 had jumped from an animal to a human at a Wuhan food market where wildlife was sold. More recent evidence suggests that it originated elsewhere, but the number who fell sick after shopping there indicates it played a crucial role in spreading the illness. The Wuhan market looks to have served perhaps as an amplification center, if not the exact beginning of the outbreak of coronavirus. While deforestation and wildlife trade are blamed for diseases leaping from animals to humans, globalization can turn such outbreaks into pandemics, as has happened in the instant case. These are the matches that light the pandemic fires, but the fuel on the fire is the globalization of humanity and the increasing population density in cities that's helped make this pandemic a very contagious one. 50 years ago, it would have been much harder for COVID-19 to spread from Wuhan around the world. Residents had neither the means nor the option to travel. Wuhan airport, in fact, did not start international flights until 2000. Scientists think that Ebola crossed into humans long before the first recorded outbreak in the Democratic Republic of Congo in 1976. The chief difference in the 2015-16 outbreak, which spread across West Africa, was that the first infection was thought to happen in Guinea, near the Sierra Leone and Liberia borders, and that's from where it transmitted to the rest of the world. There was enough connectivity, the roads were good enough that cases of Ebola for the first time in history made their way to capital cities, where suddenly there were millions available to be infected. As reversing urbanization is not a feasible option, as you can well understand, that more must be done to build public health infrastructure and disease monitoring systems. Knowing the frequency with which such new viruses are occurring and what climate change does to animal ecosystems, it's safe to assume that we are likely to have more and more of these even in the future. And one would not be surprised if the frequency increases and we see after this coronavirus has gone and is written off, you find another virus waiting in the wings. So in the journal Science, you find that Dr. Bernstein of Harvard University calls for governments to spend a combined $22 billion a year on preventing deforestation and regulating the wildlife trade. He also recommends spending hundreds of billions of dollars on systems to detect and control disease outbreaks, including a library of virus genetics, which makes great sense to me, that could be used to pinpoint emerging pathogens quickly enough to stop their spread. Now, the suggested sums are vast, but they are a fraction of the economic and the human cost that COVID-19 has caused all of us, as we well understand. And this could reach $10 trillion to $20 trillion now, this COVID-19, the crisis which it has caused, and up to a quarter of the global gross domestic product of $80 trillion. So $80 trillion is what we assume to be the world's GDP, and the amount of economic and human costs, the loss of work and the medical costs that have been involved are now expected to cross over $20 trillion. That's the huge cost. It is better that we take more corrective steps. Otherwise, we find a new coronavirus lurking in the background, in the horizon. Take care. Bye-bye.